Hello, everyone, and thank you for joining us for the New to Medicare, the Beginner's Cheat Sheet webinar. My name is Bailey Lawson. I'm one of the specialists on the Provider and Outreach Education team, or PO team, as you'll hear it, at WPS, and I'll be your speaker today. Assisting me today is my friend and colleague, Mary Mugo. You heard her voice pop in. She'll be monitoring the chat and helping me during the webinar. Today, we are going to discuss why Medicare is important. We're going to do this by diving into what Medicare is exactly, who is eligible, and where the funding comes from. Remember, this is designed to be a high-level overview and is labeled as New to Medicare. And New to Medicare is for those with 6 months or less, or those wishing for more of a review. I say this because if there is a question that you may have that does go more in depth on a specific topic, we won't be covering that because I don't want to confuse anyone who is new to Medicare. So we're going to keep it very high level and on topic. This is a series, so we will have events that do go into more detail on certain topics. I know we have people in here that are very, very new to Medicare and they don't even know what claim form they use for billing. So I just want to make mention of that so that you aren't super confused by the end of this and why we're keeping it high level. If you are fresh to Medicare, these are some acronyms you may not know just yet. There are a lot of acronyms within the Medicare world, and if you don't know what they mean, you can feel a little lost. These are definitely some acronyms that you're going to be seeing a lot, so I want to make note of the generalized acronyms of Medicare. And I say generalized because I do have more acronyms later on to share with you that are more pinpointed to a topic, where this is Medicare overall. Okay, getting into it, CMS stands for Center for Medicare and Medicaid Services. DHHS is Department of Health and Human Services. DME is Durable Medical Equipment. HH&H, or you'll just hear it HHH, is Home Health and Hospice. MAC is Medicare Administrative Contractor, which is what we at WPS are. And finally, RRB is Railroad Retirement Board. There are a lot of acronyms, like I said, in the Medicare world, and I know that that alone can get confusing, like I said. So I'm going to have Mary add a link in the chat to a resource WPS has. It is a searchable acronym list that is listed in alphabetical order. I want you to make note of this resource because if you are ever looking at something and you have no idea what it means, you can do a quick search within this list and find out the Medicare meaning to this acronym. And I say Medicare meaning because sometimes you can Google it and it'll be a completely different acronym. So this just keeps it within the realm of Medicare. I personally have it bookmarked myself. So the reason we're all gathered here today, what is Medicare? This may seem kind of silly to go through the funding, administration, and inner workings of Medicare, but these will go hand in hand in understanding the program, and it will kind of lay the groundwork for you learning things that are more specific. Medicare is a form of insurance. It's a federal health insurance program that was passed into law under the Social Security Act, Title 18. When you look at your paycheck and you see something called FICA being taken out, and you know that scene in the show Friends when Rachel says, "Who's FICA and why he's getting all my money?" For all of you Rachels out there, I'll introduce you to him. FICA stands for Federal Insurance Contributions Act, and it is the taxes you pay that fund Medicare. Your employer also pays a portion of this tax. This is how Medicare starts with its funding with FICA. So every time you get paid and you look at your pay stub and you see FICA and he's getting all your money, that's your money going towards the Medicare benefit. It is an insurance program, and it does so happen to be the largest insurance program in the United States. As of August 2025, there are 69.3 million people enrolled in Medicare, which is a bump from March 2025. Actually, it was 68.6 million in March 2025, and now it's 69.3. Just breaking those numbers down a little further, 90% of those enrollees are in the category of age 65 and over. 51.28% of those who are enrolled in Medicare are enrolled in a Medicare Advantage or have other coverage. And 81% of Medicare enrollees are also enrolled in Medicare Part D coverage. From that overall 69.3 million, that is just about 20% of the US population. That is why we are going to take the time to learn and understand the rules, laws, and regulations of Medicare. If you think about how many people that is with Medicare, you're likely to encounter someone at your office that has Medicare. Medicare is a federal insurance, federal meaning the US government, and because of that, we are going to take some time to talk through administration. To start off, we are going to look at this tree that shows the flow of Medicare through the government. It did start with Congress, and Congress did put a law in place, which is that Social Security Act Title 18 I mentioned earlier, and the president signed it into law. This happened in 1965 and of course has evolved since then. At the top of the chart, you can see the Department of Health and Human Services, or DHHS. This is who makes the whole chart flow. This part of the executive branch, meaning that this is part of the executive branch, meaning that it does fall under the President of the United States. This is the departmental secretary, and that's who sits within his cabinet and advises him on health and other related info. Health and Human Services is a much bigger category than that, but for now, flowing down the chart from the Department of Human and Health Services, DHHS, we can see that they work with CMS, Center for Medicare and Medicaid Services. CMS is responsible for daily operations, and what they do is hire different contractors and people to work with the Medicare program. The goal is to have a working program that is done through affordable contracts. The goal is to save money while still having a working, flowing program for the people that have and use Medicare. In order to do that, CMS will hire contractors, which you can see at the bottom of this chart. First, we will start with the claims processing contractors. The first one at the bottom left of the tree is called AB MAC on that very left at the bottom of the chart. This is Medicare Part A, and depending on how you label it, it can be referred to as hospital or institutional insurance. Next, there's Part B, which is supplemental coverage, or you may hear it referred to as outpatient coverage. Either way, these are both what is called traditional or original Medicare. Those are the two names for it as well. There is also the durable medical equipment, or DME MACs. And remember, MAC is Medicare Administrative Contractor. So hence the contractor portion of this. And this is separate from Parts A and B, though it is a benefit of Part B. And that's a little confusing, I know, but with the DME MAC, Durable Medical Equipment MAC, their job is to process claims for durable medical equipment to help avoid fraud and abuse because of the specialization that's within it. Next is HH&H, Home Health and Hospice. This MAC is specialized under a home health plan of care or a patient with less than 6 months to live. Because of the uniqueness of these benefits, there's a separate MAC to process these types of claims as well. And last on the chart is the Railroad Retirement Board, RRB MAC. Medicare uses two entities to determine eligibility, one of which being the Railroad Retirement Board, and then the other is the Social Security Administration, in case you were wondering. If the Railroad Retirement Board deems someone eligible, there's a separate MAC that processes those types of claims. And so that's the basic layout of the administration involved in Medicare. Here I have another list of acronyms for you. These are in correlation to eligibility. I know that some of these may seem silly to you to add because you would use them outside of Medicare as well, but I'm going to add them anyway. So first we have DOB, which I'm sure everyone knows, but in case you don't, it's DOB is date of birth. ESRD stands for end-stage renal disease. RRB is Railroad Retirement Board, and SSA stands for Social Security Administration. I'd mentioned these previously, but we'll just cover those again so we'll really drive it home. These might not necessarily be acronyms you hear every day, but they are important to make note of. So now that we have an idea of the layout of Medicare, we're going to dive into the who of it all. Who is eligible? What makes them eligible? This is one of those keys to understanding Medicare, eligibility. Like we talked about a little bit earlier, there are two entities that determine if someone is eligible for Medicare, and that is the Social Security Administration, SSA, or the Railroad Retirement Board, RRB. There are really two categories of people that are eligible. Those over 65 and those under 65. I know it's not typical to think of someone under the age of 65 as being eligible for Medicare, but this typically happens when they're deemed disabled. And we'll go over each of these categories within this event. I also want to take a minute to point out the different cards here on the screen. If you look at the Medicare cards that are on the slide, notice on the bottom of the sample cards, the one on the front right has Railroad Retirement Board written across the bottom in that red block, and the one on the left does not, the back left. They're both sample cards and they both contain the same information, and this is just to show you the difference and what each would look like. When Railroad Retirement Board is written at the bottom, that means that's who they go, that's how they get their eligibility, that's who their eligibility is through. And when it does not have that, and it is just the red bar, that means their eligibility is through the Social Security Administration, SSA. That is who you would contact about questions for that patient. One thing to be aware of with this is that every patient with Medicare will receive a card. It doesn't matter which entity determined them eligible. They may receive additional cards should they opt for other portions of the plans, and these cards will remain with them and they do not have an expiration date on them. So even if someone who was once deemed disabled and is now not deemed disabled, they would still have what looks like an active card, and that's what you as the provider or representative need to check to make sure if they still have Medicare, and that's how you would know who to contact. Now let's talk about who can have Medicare. Like I said earlier, there are two entities that can deem a person eligible. And again, that's the Social Security Administration, SSA, or the Railroad Retirement Board, RRB. And you can determine this by looking at their card, like we talked about, or there are also portals you can use. A person can become eligible through themselves, and what I mean by that is they themselves have worked enough quarters in their lifetime that allows them to be eligible. A patient can be eligible under their legal spouse who worked the required amount of quarters in their lifetime, and I will cover what this means later on, the quarters of it all. So if they have never worked in their life, but their spouse or even an ex-spouse was eligible, they can be eligible underneath that spouse or ex-spouse. I bring up ex-spouse because let's say the couple divorces, but was married for 10 plus years. the Social Security Administration or Railroad Retirement Board can deem that person eligible under their ex-spouse. A child could also be eligible. This is when the person working or paying for Medicare has a child that's deemed disabled before the age of 18. This type of Medicare can start at birth and be through the child's lifetime. It just depends on when and how they were deemed disabled. And last are parents or legal guardians. The two kind of go together. If someone is legal guardian or is a guardian of their parent and they are responsible for that parent's insurance and they add them to their working policy, they can be eligible underneath that guardian. So let's say I myself am the working person and I've worked my 10 years or 40 quarters to be eligible, and maybe my parent never did. Maybe they didn't pay the Social Security, they didn't pay the Railroad Retirement Board. They can become eligible under me. For legal guardian, this could be a child under the age of 18 that you have legal guardianship of, and because of that, they're not your child, but you are legally obligated to provide them insurance. That's what we look at for that. And we at WPS, as the MAC, the Medicare Administrative Contractor, cannot help with eligibility, and we can't answer questions for eligibility. It's just not that we don't want to, we don't have access to that. The primary function of WPS as the MAC is to process claims. When you talk about eligibility, you do have to go through and look at the Railroad Retirement Board or Social Security Administration. So I did just want to make you aware of that as well. We just don't have access to that information. So Medicare breaks eligibility up into a couple of different groups. If you remember earlier, the two main groups being age 65 and older and under the age of 65. The first group we are going to go over is age 65 and older. This group can be eligible under themselves or a spouse, like we spoke about earlier. I do want to go into when eligibility begins because it can be a little confusing. Eligibility does not start on their 65th birthday. It is the first day of the month in which they turn 65. For example, if a person's birthday is September 29th, they would then be eligible on September 1st of the month they are turning 65. If their birthday is the first of the month, it is the month prior. So, for example, if their birthday is October 1st, then they would be eligible September 1st. Commonly, this group will receive their cards 60 to 90 days prior to their eligibility date. This just ensures that their card is on file. That's why we do sometimes get denials saying that this person is not eligible yet. The patient may have their card, but the system goes, yeah, not yet, buddy. So just be mindful of that. Just because they have their card in their hand does not mean they are eligible just yet. Remember, I said there's no dates on it. And that is just a 60 to 90 day period where there is that concern, but it does happen. Age-related or 65 and older does represent about 90% of the population that has Medicare. If you're more of a numbers person, that's approximately 62.3 million out of the 69.3 million total people who are enrolled in Medicare, just to give you an idea. The next category that we will go into is people under the age of 65. I know this can seem kind of weird. I know when I was first learning about Medicare, or not even learning but knew about Medicare, I thought that the only category was over the age of 65, but it can happen and it does happen. Eligibility requirements are a little different for the under the age of 65 category than they are for the over the age of 65 category. First, for under age 65, they do need to be receiving SSDI, which is Social Security Disability Income, or be eligible under disability through the Railroad Retirement Board, RRB. Not common and very rarely done, but it is possible. It is common that they will be receiving this disability income and will have to wait 24 months after they are deemed disabled for their Medicare coverage to kick in. It doesn't always start immediately just because they have a disability or have been deemed disabled. 24 months is the most common time frame of a wait period that you'll see for this category. A person who is entitled to monthly Social Security or Railroad Retirement Board benefits, RRB, on the basis of disability is automatically enrolled into or entitled to Part A after receiving disability benefits for 24 months. Disabled federal, state, and local government employees who are not eligible for monthly Social Security or Railroad Retirement Board, RRB, benefits may be deemed entitled to disability benefits and automatically enrolled in Part A after being disabled for 29 months. Can the wait period be shorter? Yes, and this is a case-by-case basis. Say that someone is diagnosed with ALS, for example. Think of how rapidly that can cause deterioration and how quickly the ability to function independently disappears. Because of the severity of this type of condition, a person can be deemed eligible immediately, and that is done through the Social Security Administration or the Railroad Retirement Board, SSA or RRB. Another thing to be mindful of is that if for any reason the person is deemed no longer disabled, like maybe they've gone through rehab, thus ending that disability coverage, which also means ending their Medicare coverage at the end of that month. So if they're deemed no longer disabled on, say, the 5th of the month, their coverage will finish out until the 30th or 31st, whatever the month falls on. While they may be deemed disabled and they get Medicare, it doesn't always last forever. There is also the ability to be retroactively eligible with this group and with being deemed disabled. This just means that it allows the patients to have their coverage backdated, potentially covering past medical expenses, but it typically requires paying premiums for those past months. With this, it will have an effective date. This may not be the issuing date. This may be something different. And because of this, people in the under 65 category can receive their cards years after their eligibility date. So a person under 65 who is disabled loses their disability income, also loses their Medicare eligibility. However, their card will still show they are active. Because remember, there's no termination, no expiration date on that card. This is also something to be aware of when checking eligibility. This is a separate category within the Social Security Act, which is why it is considered its own disability category, which is end-stage renal disease, or ESRD. This is something that was added later under the Social Security Act. It is reported by a physician or their office or someone treating them for ESRD, and they must report this to the Social Security or the Railroad Retirement Board. More commonly, it's the Social Security Administration, though. Once it's reported, there will be some questions asked. For instance, have they started dialysis? If the answer is yes, they have started dialysis, then coverage usually starts the first day of their 4th month of their dialysis treatment. Or have they received a kidney transplant? So there's questions like that that the answers will need to be reported. If this reported part occurs later, then this is something that can also have retroactive coverage. However, ESRD, end-stage renal disease, does not automatically equal that you will receive this for life. Coverage, that is. The first thing to make note of is that if you have ESRD, end-stage renal disease, and you choose to stop your dialysis, 1 year from stopping that dialysis treatment, you will lose your eligibility for Medicare. This is then reported to the Social Security Administration. In terms of a transplant, if you have a successful transplant, 3 years after the transplant, it is covered for this long after the transplant to verify that there are no complications. Then Medicare coverage will end. Keep in mind, there is a section of Medicare within the ESRD, end-stage renal disease provision, that says that immunosuppressive drugs can be a continual coverage. It's a completely separate section, and it does cover a certain area. This is just an extra insurance that the person who got that transplant continues to be healthy and doesn't reject the new kidney. It would not be a fun time to have to go back through all those steps again. So keeping them healthy in the first place is the goal. That's why the immunosuppressive drug coverage help that goes with that continues. What happens if the kidney does fail? Well, Medicare coverage can be restarted after it's been terminated. So if they have a successful kidney transplant and everything's going good, and say several years later, this kidney begins to fail, now it's reported back to the Social Security Administration, SSA, and we're going to fall back to the basic guidelines so they can have Medicare under that end-stage renal disease, ESRD. And something I want to make note of is that the whole time that they've had Medicare, their Medicare will show a single effective date, like I was talking about earlier. So let's say they had the kidney transplant, it's going fine. After the certain amount of years, coverage ends, and then it starts to fail years later. That date on their Medicare card will never change, regardless of the termination of the eligibility and the restarting of the eligibility. It's the same date. All right, so like I said before, Medicare is an insurance program, and the funding for this has to come from somewhere. So we're going to get into that and dive a little bit deeper. Okay, this is the last list of acronyms I have for you. First, we have FICA. Remember, Rachel said, well, who is FICA and why is he getting all my money? It's Federal Insurance Contribution Act. Then we have HI, hospital insurance, MA, Medicare Advantage, PDP, prescription drug plan, and SMI, supplementary medical insurance. I know that I've thrown a lot of acronyms at you today, and I don't want you to stress about remembering everything, and you don't have to, because with that being said, I mentioned it earlier, but we do have a resource on the WPS website of acronyms, and I've asked Mary to add that into the chat. If you ever need to find it again, there is a link to the list in the Tools tab at the top of the home page. You'll click All Tools. At the top ribbon, it'll say Tools. You'll go to All Tools, and then it's listed under Acronyms list. So first, the money begins and comes in through FICA. Both you and your employer pay this, like we discussed a little bit earlier. When this is coming out of your paycheck, that means you are paying into Medicare. This is then administered through the federal government and put into different trust funds. You'll see the two trust funds on the bottom. The bullets are talking about interest. but the premiums do go into the trust funds as well, so that's why I'm bringing them up now. One is the health insurance HI trust fund. This is the Part A trust fund. It is where the money goes for that. The second one, the Supplemental Medical Insurance SMI trust fund, is the Part B trust fund. Just as a pointer, Part A is everything inpatient. That's why some people refer to it as hospital insurance, and Part B is everything outpatient. However, there are also premiums, and that money is then added into the trust funds. The premiums for Part A are not for everyone. They are for less than 1% of people that do have Medicare. And this is defined as people who have not worked 40 quarters in their life. They must pay a premium if they choose to have Medicare Part A. So you've heard me mention quarters throughout this event and working the amount of quarters in order to be eligible for Medicare. So what does this mean? Or this is what I mean. If you've worked 40 quarters in a lifetime, this means you've paid into FICA 40 quarters in a lifetime. It doesn't have to be consecutive. It doesn't have to be continual, nothing like that, but you've paid 40 quarters or 10 years, then it's free to you. So let's say you stepped away to be a stay-at-home mom for a couple of years, and then you restarted up your job working once the kids went into school, whatever the situation may be, or you yourself went back to school. That doesn't restart your quarters. You just continue on from what you've already paid into. That's why most people have it free. The premiums for Part A are done in a tier system. If you work 1 to 29 quarters, in 2024, your premium was $518. If you worked 30 to 39 quarters, your premium was $285, so a drastic difference. So as you can imagine, someone who would not be eligible because they haven't worked 40 quarters for free Part A may say, I can't afford $518 a month. They're able to make that choice, make that decision that they're not opting for that coverage, they opt out. Medicare Part B also offers a premium. However, the difference from Part A is that everyone must pay the premium. This premium can be covered through Medicaid or other types of supplemental insurance that can help with that premium. On average, the Part B premium is $185 per month in the year of 2025. This did increase from 2024 by about $10. It was $175-ish in 2024, and now it's $185. Then you have Part C and Part D, and these plans do vary. Some of them do have premiums. Part A is hospital insurance. Part B is that supplemental medical insurance, outpatient coverage. Also, two other forms of money are interest payments. Both trust funds have interest payments, and because they have interest payments and there is money sitting there waiting to be used that you paid in already for when you retire, that's also a form that interest will be there. Let's talk about the 4 parts of Medicare now. You've heard me make mentions of Part A and Part B. There are also Parts C and D. I am now going to take the time to break these down for you. Medicare did start with what is referred to as traditional or original Medicare, which is Part A and Part B. In the graphic on the slide, you'll see it labeled as hospital, which is Part A, and medical insurance, which is Part B, but that's what those mean within that graphic. Then there was a law passed, and it was to give patients more options than just traditional Medicare. And in order to give the patient more options, private insurance or private companies were created that were meant to replace traditional Medicare, and that is what Medicare Advantage plans, Part C, are. As of right now, about 55% of people with Medicare choose to use a Medicare Advantage plan. This is a separate enrollment and a separate claims processing area, system, everything from traditional Medicare. It's completely separate. So when they do that, they give up traditional Medicare and they have to follow the rules of the plan that they chose. And that can have a different variety of rules. People do have to opt into Medicare Advantage plans or Part C, and they can opt in when they first start Medicare. There is an open enrollment period, typically mid-October through mid-December each year when they change plans, go back to traditional Medicare, do whatever their heart desires. And the last part of Medicare is your prescription drug plan, PDP. This also is referred to as Medicare Part D, as in dog. This is the newest form of Medicare. Traditional Medicare Part A and Part B are not allowed to incorporate Part D. But Part C, the Medicare Advantage, C as in cat, is allowed to incorporate Part D as in dog. So when we look at all of this information, 80% of people who have Medicare choose to have a Part D as in dog plan. Some of those people are using their Medicare Advantage plans to also incorporate that Part D coverage, meaning they don't necessarily need that separate coverage. Others will stick with Part A and Part B and make the decision that they are going to also have Part D. So it really just depends on the person. Some will say, I don't want it at all. I'm not going to deal with that. Some are saying, I can barely afford Part B, so why would I want to add Part A or Part D or any other part for that matter? It really is the patient's decision as to which types of plans they want or don't want to enroll in. And come enrollment time, they don't have to stick with the same decision they made last year. They can change things around if it's not working for them. So in terms of how this affects you as the provider, first, please understand that you as the provider will traditionally enroll in either Part A or Part B. Some providers, such as hospitals, will enroll in both Part A and Part B. If you choose to, you can enroll in Part C. It's not something that is required, but it is a separate enrollment, and Part D is, again, the pharmacy. Okie dokie. I am going to pull up some resources for you right quick since we have a little bit of extra time. Let me get to the WPS website here and make that bigger. So I had mentioned to you how to get to the acronyms list, and I'm going to show you. So we're starting on the WPS website, the home page. And to get to the acronyms list, you'll go to Tools, All Tools, and then Acronyms list. And this will show you acronyms, all of the acronyms, and then you can filter through them. So if you've heard a specific one, like I've been saying MAC a lot, you can look through Medicare Administrative Contractor. So that's how you can search through that. Next, I believe this is also in DDE manual, the quick links, DDE manual. I'm in jurisdiction Part B, so this is for my Part A folks. I'm going to move over. You can see if you're ever looking for things like the direct data entry manual and maybe something didn't come up, this triangle shows that it indicates, hey, you've selected jurisdiction B and this is for jurisdiction A. It doesn't change anything for here, but just make note of that. You can download this manual. This is for those who use the UB04 claim form or the 837I. I just want to show you this because it's a great resource that's available to you. out here on our website. And I know, like I said, a lot of you guys are very, very new to Medicare, and some of you have even put when registering that you don't know what claim form you even use. So this would be very helpful to you. Something else I want to show you, this is the SNAP portal, the Secure Net Access portal. This is a very large hub for things. So I'm going to show you the portal user manual. It's right here. This is how you sign in, but this is the manual. This is a great, great, great resource that's available to you. It doesn't just have to do with the portal itself. It like troubleshooting technological issues, which is what I would think for a manual, a user manual, but it does have other things in there for you. And one thing I do want to point out, since we talked a lot about eligibility today, did I pass it already? Yes. Eligibility, you can do an eligibility check, and it gives you instructions on how to do that within the portal. And it gives you great graphics, and it shows exactly, step by step what you need to do. And that's what it'll look like. And that's a great resource out there for you. Something else I do want to show you, sorry for my scrolling. Here in the training center, I just want to make you aware of an event for my new to Medicare folks. Our co-worker, our colleague Leanne, she puts on a monthly event, and if you've been in any other of my events for new to Medicare, I always bring up this event because it is a great, 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 great resource for those of you working through provider enrollment, PAYCOS, any of the things you have questions on regarding provider enrollment. It is Journey to Medicare. Oops, sorry, that went all of them. Journey to Medicare Success. This one right here, December 11th, 2025, so tomorrow. For me, it's at noon. I'm Eastern time, noon to 1. If you're Central time, it's 11 to noon tomorrow. And she does a very great job of answering all the questions. And if you are wanting anything that's more specific, here we have that. That's a great resource for you. Check it out. If you can't make it tomorrow, no worries. She does a monthly event. Her next one is January 5th, right here. Journey to Medicare Success. I highly, highly recommend that you go and enroll in that. I told you this is a series. My next one in the series is New to Medicare, Your Self-Service Toolkit. That's our next one on January 6th, so make sure you join me for that one as well. And I just wanted to show you all of those. We'll go back to the training center. For my new to Medicare people also, we have a whole entire tab under our training center. I'm going to click into that. This gives you so many resources. It gives you, I'll scroll here. It shows you, it takes you to the CMS YouTube, our YouTube channel. It gives you breakdown of playlists. New to Medicare, that's a great one to start. And then we also have provider enrollment. These are all great. I should say they're very, all of our information is great and jam-packed. But if you're going to start somewhere, I would recommend New to Medicare and then maybe move on from there so you don't confuse yourselves, because Medicare is it's a beast to learn. So we also have web-based training, and I do want to mention, if you see how these are a royal blue color and they've got the box and the arrow, this just means it's taking you to external site. So this is, as you can see, CMS offers the following, and we give you a little description, and you just click into this and I'll show you what it looks like. It's just like a little course that you can go through, and it gives you a lot of information. So those are some great resources to be had. I think that's all that I have that I wanted to share with you in here. And then I have more CMS websites, let me show you the Medicare and You handbook. I show this all the time. Let me bring this back over. I show this because it is a great resource for, it is a patient resource, but as people who are new to Medicare, this is great because it gives you very layman's terms what Medicare is, so it's not very confusing. Because I know sometimes it can get a bit confusing when you're on the CMS website looking through resources. This is very minimalistic information, so it gives you a lot of information. It breaks it down by the parts of Medicare. As you can see, it tells you what it is. If you click on the page, it takes you right there where what does it cover. So if you have any questions, this is a great resource, even though it is technically for patients. It also helps you as the provider when speaking with patients. You can give them this resource and kind of walk through them with it, because it is confusing on both ends. So if your patient ever has questions, you can refer them to this. You'll know how to answer. Great resource. I love recommending this with new to Medicare. And then the patient website just in general is just this, medicare.gov. And this too gives you great information. You got the basics, get started with Medicare, and it gives you a lot of great information. And I know this again is a patient resource, but it's great for providers as well. That back over. All right, I don't think I've seen any questions in the chat, but I'm gonna go over to you, Mary. Have we had any questions in the chat? Do you have anything to add?
No questions in the chat.
All right, thank you so much. So we'll get this wrapped up. Before I move on, I do want to make mention we do a Medicare Education Expo event. It's an all-day event. We've done 2 so far. Our last one was Halloween themed because we did it in October. This one will be in January, and it will be winter themed. So we are covering the departments of WPS, so you can get a little bit of knowledge with that. And since you folks are new to Medicare, it would be a great event for you to attend. So be on the lookout for that. The registration isn't out yet. It is January 27th that will be out, but they will be posted soon. It's, again, like I said, it's an all-day event, but you can pick and choose which ones you register for based on your schedule. And so I did just want to make mention of that as well. Alrighty. In a few minutes, you will receive an email with the subject, "Thank you for attending." Do not delete this without reading it. This email contains your certificate of achievement. This will have all the information you'll need to submit for your CEUs, continuing education units, if you need that. If you don't see it, make sure you add the WebEx email address to your safe sender list. If you called in from a phone and followed along on the handout materials, you'll receive an email that says, "Sorry, we missed you." This is just because you didn't register with that phone number. So WebEx doesn't realize you've attended. So it's looking for your email. That's not a problem. Just email wps.gha.education@wpsic.com and put the webinar's name and date as the subject, and then just let them know you called in and what phone number you called in from, and we can verify attendance that way through your phone number, and we can get the certificate to you. One thing of note is when you're looking at the email, the certificate won't be an attachment. It'll be within the body of the email. Just look under the heading certificate, and that's all the information you need. It's not going to be an actual attachment certificate. If you do end up having additional questions that maybe you thought of after the fact, or you're looking through the handout materials again, have no fear. You'll be able to submit those questions for 7 days following the event. Just send them again to that education mailbox, wps.gha.education@wpsic.com, which is in the chat. Thank you, Mary. And put today's date and new to Medicare in the subject line. That just ensures that the email goes to the right person, me. And all claim-specific questions will need to go to customer service, so keep that in mind. We don't have access to any of that information, so we can't answer any questions specific to claims. We can only answer questions specific to previous education. And lastly, please take a few minutes now to complete a survey. Tell us what you liked, what you didn't like, what we could do better, suggest topics for future education. It doesn't have to be specific to Medicare. We've added chapters to our YouTube channel. It's kind of like the table of contents for a book, but with the video. So if you are watching this encore back and you're like, well, I want to go to the part where Bailey talked about the parts of Medicare. Well, I'll have that labeled for you so I take out the guesswork for you. You can just click to that part of the video. That was from a survey comment. So we really do listen to what you have to say on those surveys. There are different options to take that survey depending on your preference and what's easiest for you. Mary did add a link in the chat. You can also, when you exit, you could see here, there will be a pop-up that comes up with the yellow triangle. Not to fear, it's not malicious or anything. It's just letting you know it's going to CMS's an external site from WPS. So it's a CMS website going to the survey. You can just click that continue button and take the survey that way. And it only takes a couple minutes, and I would really love it if you could just leave me some feedback. I would love if you could do that for me. And with that, on behalf of myself, Mary, and Provider Outreach and Education, thank you so much for your participation. We look forward to your survey comments and hope to have you join us for future events. Have a great rest of your day and a great rest of your week. You may now disconnect.